Today, this 30 years old male patient presented with complaints of discomfort in the right eye, especially in the right and up gaze. There were mild pain as well. Now, you should observe his extraocular movements keenly, and you will find his problem, the disease. Now his left eye is having limited elevation in adduction, whereas the right eye is more hypertropic in the right and up gaze. So on the basis of extraocular movements, we diagnosed this patient as left Brown syndrome. Now, what is Brown syndrome? Brown syndrome is a vertical restrictive strabismus characterized by limited elevation of the eye in an adducted position secondary to mechanical restriction of superior oblique tendon trochlea complex. Often, the hypertrophic eye is mistakenly presumed to be the abnormal eye, but it is actually the lower eye that is affected. Elevation is normal in abduction but defective in adduction. Now this patient presented with right gaze pain and discomfort, but usually the patients of Brown syndrome will present with vertical diplopia, pain with eye movements, abnormal head posture. A click sound may be heard when attempt to elevate the eye in adduction. Now key finding is limited elevation in adduction, normal primary gaze, compensatory abnormal head posture with chin up and head turn away from the affected eye. On forced adduction test, there will be restriction to the elevation in adduction. Brown syndrome secondary to inflammatory condition may be associated with orbital pain and tenderness to palpation to trochlea. Mostly occurs as congenital condition. Pathology is limitation of the normal function of the superior oblique tendon trochlea complex. Rule out cyst or mass as well. Acquired can be due to cyst, mass, inflammation, trauma, or iatrogenic due to anterior orbital or vertical strabismus surgery. Diagnosis is clinical. Differential diagnoses are inferior oblique palsy, double elevator palsy, thyroid eye disease. Treatment depends upon the cause. Observation is often preferred as symptoms usually absent in the primary and down gaze and only appear in up gaze, which can be avoided for the time being till the recovery of the disease. If inflammation is the cause, steroid injection into the trochlea may provide fast recovery. Oral steroids can be given as well. Indication for surgery in hypotropia in primary gaze, significant abnormal head posture, significant diplopia, significant pain, tenotomy, tenectomy, superior oblique expansion surgery, and in case of muscle cyst, removal of cyst may be done. Brown syndrome is clinically as well as exam point of view very important, so I thought I should share with you. This patient was actually seen by my dear friend Dr. Hafiz Ahmed. So I should thank him for providing me such an important case.